When discussing the history of prosthetics, we must take considerations from the ancient Egyptians. The first transtibial prosthesis, made out of fibers, is known to be invented by the Egyptians. The Egyptians wore it to feel normal and look normal, through having another object fill up the empty part of their bodies. Thus, the first transtibial prosthesis primarily focused on looks rather than functions. However, they are known to soon have paid attention to functions later on. During 300 BC, the transtibial prosthesis is known to have been made out of wood, bronze, and iron. During the Dark Ages, when knights existed, transtibial prosthesis was known to replace legs, so that the knights can ride horses. By this period, some transtibial prostheses were known to be able to perform limited function, but it was only available for the wealthy due to its expensive price. The transtibial prostheses were generally made out of wood, and were known as peg legs. As interest shifted to art and science, more attention was directed to the development of prosthetics. During this time, the transtibial prostheses were developed to be made out of steel, wood, copper, and iron. With new insights into coordinating function and shape of prosthesis brought by Ambroise Paré, Pléter Verdouin developed the first non-locking transtibial prosthesis that formed the basis of today's transtibial prosthesis development. Later, a man named James Potts incorporated catguts to link the steel knee and the wooden leg to the ankle. Unlike the previous models, the modern transtibial prostheses are made out of lighter and stronger materials such as aluminum and plastics. Also, because legs bear the entire weight of the body and also be able to be moved easily, for sustainability and comfort, carbon fiber and foams were also primary materials for modern transtibial prostheses. Nowadays, through covering up silicons, the artificial legs are now more visually pleasing and natural. Various technological factors such as computer chips are beginning to be implanted for better functioning of the transtibial prostheses. Various types of transtibial prostheses are also beginning to be developed for specific sports. The artificial legs are specially built for better functions and performance of the patients. For example, this cheetah leg is specifically designed for runners due to its lightness and elasticity. This leg is designed for swimming. This leg allows the ankle to be further stretched for a better flexibility and balance when swimming. These kinds of special sporting legs are beginning to be developed for those athletes who have lost their limbs. With semi-natural functioning of the transtibial prostheses, the prosthesists are now looking to develop myoelectric legs, which allow the direct interaction of the artificial leg and the brain, just like how the real legs work. The prosthesists are also looking for development in engineering to enhance mobility and also prevent the damage of the contact points of the residual limbs. Continual attachment of artificial limbs may lead to infection and cause pain, and this will be discussed later in the video. As artificial legs are used, the attach point of the leg, called the stump, is gripped by the socket of the artificial leg. This leads to the shrinking of the size of the residual limb, and also generates pressure points and ulcers, eventually making the patient impossible to use the legs anymore due to the intense pain. Also, the open side of the residual limb is vulnerable to infection from scars or any kind of damage while using prosthesis. In some cases, with bones growing out of the skins, excessive bone growth hinders the usage of prosthesis as well. The transtibial prosthesis replaces these muscles: fibularis longus, extensor digitorum longus, tibialis anterior, gastrocnemius, and soleus. In terms of bones, patella, tibia, fibia, tarsals, metatarsals, and phalanges of the feet are replaced by the transtibial prosthesis. The challenges that a new user needs to overcome is basically the complications of using prosthesis and training to be able to use the artificial legs freely. Because the skin of the residual limb can be injured more easily due to bony residual limb, and blood circulation is not as effective as before, if a damage is done to the skin, it takes a longer time for the damage to recover. In terms of training to use artificial legs, the user must repeatedly work to keep balance and be able to freely swing the legs back and forth. The leg may feel new to the
Hey, let me
users.
get a picture of what your shirt says, Ben.
Many athletes put a lot of time and effort to build their bodies to perform better. Yet, through using prosthesis, building the legs aren't necessary, and so the prosthesis users can simply take an advantage over other athletes. Although much time is needed to fully control the legs, there is no risk of injury or tiring of the artificial legs. With all these advantages, using prosthesis can be definitely seen as cheating.